We went through the gas disaster. And when we felt that we were actually getting a fresh, close breath, the air was starting to feel good, we were hit by the pandemic. And we're still one of the hardest hit communities in the state. As it stands right now, moving towards having as many people as possible get vaccinated will help us bring us back together, help rebuild our economy, help support families who have struggled to balance work and childcare, and help improve the circumstances of health and safety for our community members. Because at the end of the day, the statistics that we know, those numbers, those measures that are different aspects of the COVID in Lawrence, those numbers are actually community members. Those are our family, our friends, our neighbors. So it's not only about numbers here, it's about the people that we care about. So we are in this together. We have to do this together. Tonight, we're going to run through what we know about the vaccine, including how to get vaccinated, what the plan for the city of Lawrence is, and what are the frequently asked questions, as well as, dispelling any myth that exists. Through this, I am hopeful that we will be able to address any fears that you may have so that you can take the necessary steps to help yourself, help your family, and help the city of Lawrence. Your family and friends need this. So does our community. Things are not going back to normal as we used to. I know they're going to be better than normal. But in order to do that, we need to do this together. So let's do this. Now I would like to take the opportunity to introduce our panelists for the evening. Panelists, we are very happy and excited to have you here. When I call on you, please introduce yourself, including your name, your preferred pronouns if you wish to share, your title, and what organization you represent. I will start with Mr. Vidal Primiterio. Good evening.
Good evening to everybody. As you just say, my name is Vidal Primiterio. I'm a primary care physician at Loden Health Solutions. I've been in the community for approximately 20 years, practicing medicine, internal medicine, as well as emergency room as well. We've been located here in 25 Marston, giving a service to our community and trying to help and working together, like all of you, trying to prevent our community to keep suffering so much painful situation like we've been living in this COVID-19 pandemic. Thank you for having me.
Thank you, Mr. Primiterio. Let's move on to Yesica Santana Torro.
Good evening, everyone. My name is Yesica Santana Torro. I am a registered nurse, and I'm actually hired to work in the vaccination clinic in Lawrence. And I'm very, very excited to be doing this. Thank you, Kendrys.
Thank you, Yesica. Now I would like to introduce Martha Velez.
Good evening, Mayor. Good evening, City of Lawrence. And good evening, panelists. I am Martha Velez. I am the Director of Health and Human Services for the City of Lawrence. It's been my pleasure to serve this city for 31 years, and I've actually lived in the City of Lawrence for 52 of those 31 years. So thank you very much for having us, and I look forward to sharing all this information with everyone.
Thank you, Martha. And finally, Mike Armano.
Thank you, Mayor. Good evening, Mayor. Good evening, City of Lawrence. My name is Mike Amano, Director for the Inspectional Services Department, which is also part of the Board of Health. Together with Health and Human Services and Director Martha Velez and her team, we make up the public health in the City of Lawrence. I grew up here in the City of Lawrence, and it's a pleasure to serve the city, and I'm excited to work together to roll out this vaccination program.
Fantastic. This is exciting. I love the panelists that we have. And once again, I wish to say thank you for taking some of your busy time to share all of your nuggets with the members of the community. This is very good. But let's get into some of the initial questions and source out questions from the audience later. As we get started, let's just get some general information. So first things first, Dr. Primiterio, what exactly is the COVID-19 vaccine? And why do we have to get vaccinated?
this is a good, important question. There's a lot of people has been asking the same question. So as everybody heard, this is a different type of immunization, which we're not used to. The COVID-19 vaccination is a different type on the point that it's made up based on enzymes that send the messenger. It's called messenger RNA, which normally doesn't contain the live or dead virus like typical vaccinations. This one is gonna work sending a message to the DNA, which automatically activate your immune system to be prepared and fight when the COVID-19 virus get into your system, starting to fighting with this infection. So it's important to know, even though this is a kind of new type of vaccination that has been developed, this has been well known for decades. So this is not something new for the sciences. That is a new vaccine. It's maybe a new type that we're using, but the technology is being well known for decades.
Thank you, Dr. Primiterio. Currently, the vaccine is available in 2 shots or doses. Yesica, Santana, Torro. If someone gets 1 dose, do they have to get the 2nd dose? And also, do folks have to get the 2nd dose from the same site that administered the 1st dose?
Thank you, Kendry, for that question. That's a very good question. If based on evidence, definitely everybody has to get dose 1 and dose 2. For sure. The other questions that you mentioned, does the people have to get the second dose from the same location? Our recommendation is that they should get the 2nd dose in the same location for 2 reasons mainly that I've seen through working in the vaccination, is because it helps the patients get familiar to the location. Second of all, it helps them with anxiety because obviously everybody's anxious about this vaccine. It helps them to just be less nervous about it, right? They get to know the nurses, and sometimes they get shot with the same nurses. So that helped them release that anxiety at that moment. Also, it actually for us as a professional helps us to get the ones, because we are getting this, we're working through Lawrence General in South Lawrence East. So basically we're working with their system, which helped them stay with the record that when they got the 1st dose. So a lot of people, they tend to lose the card that they get from the 1st dose, and we able to track those numbers, especially what dose or what COVID they got, if they did the Moderna or they got the Pfizer. So we're able to get that information for them. So it's very beneficial to get it in the same place.
Thank you for bringing that up, Yesica. You brought up a good point. There's different vaccination companies right now. So Dr. Primiterio, many have asked, is one vaccine company better than the other? There are many worried that one company has more side effects than the other, that one dose has worse side effects than the other. And these are the things that I am worried that are preventing people from getting the 2nd dose, or for the 1st one for that matter. Everyone is immune, likely to have different response on the vaccine. So Mr. Primiterio, what is your response to this?
Well, both of them, they are using the same technique. So they are the same technologies. They are messenger RNA vaccine. So it's the same thing. If you want to look at it from this point of view, both is going to provide the protection that patients they need. Even though one say this is 95%, they say Pfizer is 95% effectivity versus to Moderna is 94. So 1 point doesn't make any difference. Both of them, they will protect the citizens or the patients. Now, everybody have a different immune system. Everybody respond in a different way. Some people, they will receive the Moderna and they will feel some symptoms. Other people, they will feel worse symptoms with the Pfizer. But other people, they will also vice versa feeling sicker. And other people, they won't even feel anything. So it's upon your immune system, how you respond to it is why you're gonna really have symptoms. You might not have anything. Some people, they say, well, I had the 1st shot, I didn't have any symptoms. Other people say, well, when I get the 2nd one, that was the one that killed me. I feel like I have the COVID. And this is important to let it know to the population out there, you are not getting the virus. You're not getting a COVID virus on these immunizations. So just let's keep that in mind. So people, they might have some symptoms like a fever, headache, sore throat, body ache, nausea, vomiting, a little bit, not as bad like when they have infection, but both of them, they will provide the same immunization, the same, they're gonna be covering those patients and they're gonna protect them in equally. So there's no better one than the other. Both of them, they will do the same job that we really want. Keep the whole community safe.
Thank you. Yesica, if someone contracted COVID already, do they actually have to get vaccinated?
The answer is yes. Everybody has to be vaccinated, for sure. And one of the questions that they get, what is the question? Sorry. So they all have to be vaccinated. And basically what we tell our patient is, because sometimes question comes, right? What would be something that they would not be allowed to get vaccinated? So something that we say is that people has to be symptom-free 30 days before get vaccinated. That's basically our policy that we've been following.
Thank you. And Dr. Primiterio, if someone contracts COVID, are they completely immune from ever getting COVID again?
Nope. That's a very important question. Some people, they say, well, I have COVID once or twice and I should be okay, so I don't need the immunization. No. As everybody knows, this is something new, so we're learning as we go. It's every day we're finding different information and data and facts on those, in this disease. But definitely no, because we have a COVID, that doesn't mean you're immune. You need to be vaccinated, and you also can have a COVID for the second time as well.
Okay, thank you. And now probably one of the biggest questions of the evening, Dr. Primiterio. If someone gets vaccinated, does this mean that they can live their life freely? They should stop wearing the mask, or go out there in the world at the grocery store? Can they start visiting their families and friends right now without having any worries, do parties? From what I understand, they are still carriers. What's your thoughts?
They do. You are absolutely right. They are still being a carrier, even though they are safe, they are healthy, and they are not having any symptoms. But they can pass it on to other people that they are not immunized at this point. So it's very important everybody keep wearing the mask and keeping the social distance, as we've been telling everybody. You get you 2 shots. That doesn't mean that we don't know for how long you're gonna be really immunized. We don't know yet how long they're gonna last. So don't take it for granted, like I have my immunization and okay, so I can just go back to normal. Be walking around without no mask, no keeping social distance, because you're still being a carrier and you can get sick some of your relatives, some of the loved ones, and even cause somebody dead. So we have to keep wearing our mask and keeping the social distance.
Thank you. So now, how effective is the current vaccines that are available towards the other strains?
Well, we don't have a specific data yet, but it definitely will help to prevent or make that process a little better. It's like the typical flu vaccine. Every year we just have a new strain. We will modifying those, and it's getting better and better. So we always say we're a little behind, a year behind with the different strains. So at this point, you get this immunization, you have some kind of protection from the COVID new strain that is coming out there. And eventually, if we have to develop every year new COVID vaccination, and they keep mutating, so we will have to keep working every year on updating all those immunizations.
At this point, we have discussed a little bit of, general information in regards to the vaccine, but I also think, to all of our panelists, that it's important that we address all the myths and fears that exist. So let's get into those myths and fears, surrounding the vaccine. Doctor, many have asked if the vaccine was developed too fast to be effective. What is the science behind this?
Well, remember what they use now? We were talking about the messenger RNA vaccine. It's a technique that has been there, but hasn't been used, hasn't been put in effect. If you think it's like it's being fast, think about how many people have died. So how many people, we have almost a year that we're going through this pandemic. We were losing so many human life. So scientists, they've been working hard and try to get up to speed and develop something that we can stop, or at least we can put some break into this disease. So normally we will say maybe it was too fast, but we don't know exactly how many hours, how many people they've been working behind the scene to find the cure, or to find something that is gonna help us to survive this pandemic. So it's a year that people work on so many parts of this planet. It's so many scientists that they've been working on it. So a year really is not long if we think about it, how much input people have been putting in this. Sometimes take a little longer, but this is the time, and this is what we could come out with, and it's the right time, and we have to take advantage of this if we don't want to keep losing more human lives.
Will getting the vaccine actually have an effect in those that are trying to get pregnant or those that are currently pregnant?
No, really. As you know, everybody that is pregnant or trying to get pregnant, they are being vaccinated. Always, we advise to the patients that they are pregnant or they are breastfeeding to always check with your primary care. But at this point, I don't think any primary care is gonna say, no, don't do it, because that is gonna be worse than you get some side effect with immunization. So it's very important that everybody that have a right risk, like a pregnant woman, they should be vaccinated.
And on the flip side, this is a question that a lot of community members are, I think, possibly afraid of asking, or maybe embarrassed to ask, because there's a lot of men that wish to ask this and often don't do it. Does it have any effect on males' ability to reproduce?
Not that has been presented yet that anybody's been having any issues with that aspect. So at this point, let's say for every man to get immunization, that shouldn't be affecting them with productivity. So fertility shouldn't be an issue at this point.
Thank you. And Yesica, I know many of our community members are not fans of needles, and some have great fears about needles, as a matter of fact. In your work at the vaccination site, how do you help people to try to ease their comfort?
That's a very good question. As a nurse, the best strategy that I've seen and I use personally is just to establish a conversation with patient. We all being in that place where they are sitting there waiting to get vaccinated. And obviously the first thing that I like to be like, oh, how you doing? You know, how's your ride home from home? How's the climate? Is it cooler? Like, how is it? So I like to establish this conversation so they feel comfortable that I'm gonna literally just vaccinate them. And actually it has worked perfectly with every nurses. I personally use it all the time. And at the end of the vaccination, they feel fine. And I think that's one of the strategy everybody is doing, and it's going perfectly fine. It's working.
Thank you, Yesica. I think that the work you guys are doing as nurses in the vaccination site is terrific, and it's important that we ease, this process for all residents. So thank you for doing what you're doing. And Martha, I do have a question for you. As you know, there are many videos circulating among social media, being shared by community members. And can you help us address those rumors that a microchip or anything else is actually going into people's body that is not the vaccine, into their arms when they receive the shots?
Well, that's kind of like fake news, right? It's something that people believe, but it's actually not true. I mean, as the doctor very eloquently said, I mean, one of the important things to remember is that what's really going into our arms is to strengthen our immune system and prepare our immune system for infection if we should get it, and protect against it. I think that I had a conversation with someone about a microchip, and I says, we don't need to be inserted with microchips. We have cell phones. Cell phones have a chip in it that they could really tell wherever we are. And GPS, our cars are all, with chips in them. So nothing needs to be put into our arms to find us.
Thank you, Martha. And, something else that I want to talk about is home remedies. And Yesica, the audience might actually think that this is very funny and they may get a kick out of it. But this is a real question from members of the community. Can Vicks prevent or cure COVID-19?
Yes. The answer is no. Based on proven evidence, definitely big vapor rub does not cure or prevent COVID for sure. However, patients can use it. So I liked, because I did use it as a personal use when I got my COVID shot. It did help. But I actually just asked them to rub it in their arm, which would help with their pain and inflammation. So yeah, they can do it after vaccination, but vapor rub do not cure or prevent COVID-19.
And Dr. Primiterio, let's talk about vitamin D or any topical essential oils, or even other alternatives means like, cooking. Do those prevent or cure COVID? Dr. Primiterio?
Oh, he's on.
Dr. Primiterio, you're muted.
Sorry, yes, I just went out. I realized that. Thank you. No, like you were saying, no, they are myths. People think those remedies and oils and stuff like that will cure COVID-19. No, that's not the case. Vitamin D, on the other hand, can help. It's an antioxidant. It's help with the immune system, give you some boost to the immune system, but that won't cure COVID-19. Coping also won't cure that. So it's important that people understand that there are remedies, there are things that you can do. Psychological can help you. Well, more power to you. That's okay. Whatever we can use, that's fine in order to encourage the patients. But they don't. They do not. The only thing we can say right now that is more efficient here is the immunization, which we know is being approved as an emergency situation for the FDA, only for that reason. And it's the only thing that we have right now. So unfortunately, all those remedies and things people they're thinking and saying out there is no cure.
Thank you, doctor. And so far we have discussed, general information about the vaccine, and also we've addressed some of the fears that the community members have. But it's also important that we discuss the logistics behind the vaccination effort that is happening not only in the city of Lawrence, but statewide in the whole country. So I have Mike Armano. So Mike, when can folks expect to get vaccinated? And can you please explain the different phases and which one are we currently on?
Sure, absolutely, Mayor. So people can expect to get vaccinated based on two things. One, whether they're eligible, and two, whether we have enough supply to vaccinate. So eligibility is established by a grouping of people into phases, and those phases are established by the Commonwealth of Massachusetts, and they're based on the most vulnerable populations. So right now we just got into phase 2. We're in the beginning of phase 2, and between phase 1 and phase 2, the eligibility includes people such as over 75, actually over 65 and older, people with 2 medical conditions. We have healthcare workers, first responders, long-term care. We have low-income and affordable senior housing residents and staff in congregate care settings as well. And it was just announced recently that effective on March 11th, we're going to include educators and childcare workers, including school staff, into that eligibility.
Okay, fantastic. Thank you for sharing that, Mike. And that's awesome. Now that we've heard this, Martha, how does an eligible person sign up for an appointment?
Again, I am so excited to say that I'm a Laurentian because one of the needs that you saw, Mayor, and we discussed was the ability for our community to have a number to call, and you right away approved that. And we put in our call center, and we actually did it before the state or anybody else started to do that work. And what people need to do is just call us at 978-620-3330, and we will take care of you. We have people manning the phones from 3 to 7 p.m. and people can call and make an appointment if you're eligible for the appointment.
And so you're referring to the first appointment. What about for the second dose? What if someone has to set up an appointment for the second dose?
So the second dose, in order so that people do not forget when they go to get vaccinated, their second appointment is given to them. And what we do from the call center is if we have an email or we call you to remind you of your second dose appointment so that you don't forget it.
Okay, thank you. And Mike, what if someone says, what if the current phase does not apply to me? Is there a way for them to actually pre-register for the following phase when it opens?
Absolutely, Mayor. We have a system in place, and that pre-registration is actually highly encouraged. This pre-registration not only gets you on a list, but it helps the city plan and work with some of our community partners so that we can be very efficient. And as soon as capacity is available and as soon as supply is available, we want to get our residents and our workers and our community into these vaccination sites as quickly as possible. So there's two easy ways to register. One is you can call the call center that Martha just mentioned, again, 3 p.m. to 7 p.m. And that number again is 978-620-3330. And perhaps an easier way, if you have the technology, is to log on to cityoflawrence.com/VacLawrence. That's cityoflawrence.com/VACLAWRENCE. And that will allow you to put yourself on a list, and that will help the city again collect those names so that we can get you into a vaccination site as soon as there's availability.
And I tell you, I have to tell you this publicly to both you and Martha. I'm extremely proud of the work that we are accomplishing here together to ensure that people are able to register for their first appointment and second appointment, but also pre-register. You know, I think that we are one of the only communities that are doing pre-registration at this time for the next phase. This is very significant, and I encourage all of our residents, you know, to go visit our website. And thank you for sharing that, Mike. That's fantastic. You know, another thing in terms of logistics, and this is Yesica, do people have to pay when they're coming into the vaccination site? Can they get vaccinated regardless of their insurance or immigration status? Do we ask those questions when they come to you?
Definitely. Thank you, Candy. That's a very good question. So the answer is no. Everybody's welcome to get vaccinated for free, regardless of the insurance, lack of insurance, or immigration status. So it's free.
And Dr. Primiterio, do you recommend that people who get vaccinated keep their vaccination cards? You're muted.
Forgot that I was mute. Sorry. Yes, Mayor, absolutely. Everybody should keep a record of the immunization card. We don't know yet what's gonna happen down the road. We don't know if we're gonna be needing those cards for traveling. We don't know if you're gonna need those cards for go to any specific places or activities or even hospital down the road. If they would need those patients to be, when you're gonna go for a procedure, normally they have to do a COVID test, but I imagine if you've been already vaccinated, so that will make things easier for everybody. It's gonna be more fluent, it's gonna be easy for everybody, speed up all the process, and everybody should keep their vaccination card in a safe place just in case they need it.
And going back to Martha, Martha, given the community that we have, not everyone has access to a vehicle. Is transportation available to our residents? Have we made any adjustments in our transportation system to ensure that people are able to get to their vaccination appointments?
Good question, Mayor. We've absolutely reached out to our partners, and we have different types of partners that are helping us with transportation. There is transportation for elders through Elder Services, and then there's transportation for community members, and we partner with other organizations to do that. I would highly recommend that anybody that needs transportation, when they're calling the call center at 978-620-3330, to tell their booking appointment that they need transportation, and we will take care of that for them.
That is fantastic. And in reference also MVRTA, do you want to talk a little bit about that?
Yes, MVRTA, the bus that goes right in front of South Lawrence East School, Route 37, it's been detoured to make sure that it goes to the vaccination site. Thank you, Mayor.
That is fantastic. And another thing that is not specifically transportation, but the fact that you know, the city of Lawrence, we are all so willing to help each other. You know, a lot of our PCA workers have been assisting folks. So please, when you call in, let us know if you need transportation. If you don't have a family member or PCA, we want to ensure that you have access to the vaccine, and having access is not just booking the appointment, it's also being able to get there. You know, and we want to help as much as we can. But you know, we have already discussed logistics. We have talked about, you know, the fears and the concerns that a lot of the residents have, and we essentially address general questions and concerns. But there's something very exciting that is happening, and it's let's just take a look at the vaccination sites in Lawrence before we actually turn into you know, getting questions from the audience. So the vaccination effort in Lawrence is a citywide effort currently among Lawrence General Hospital, Greater Lawrence Family Health Center. I know earlier today we had a visit with, you know, Governor Bakers to the health center to helping us get our elderly population get vaccinated at one of the housing authority sites. Martha, what can you say to folks if they happen to ask? Can they call, you know, Greater Lawrence Family Health Center and the city? What should they call the city calls number or Greater Lawrence?
We actually recommend that they call the city. They are booking their appointments. Lawrence General has a website, and you can go through the website, and they have a call center there. And we could also make sure that our appointments for Lawrence residents are through us. And then if we don't have it, we really connect them to it.
Okay, fantastic. And now for, you know, for our audience, Martha and Mike, can you please just give us a rundown of the current site that is set up here in Lawrence, you know, and talk a little bit about our current partnership with Lawrence General Hospital, the state, and, you know, South Lawrence East. And this is a question for both of you.
Go ahead, Mike.
Sure, thanks, Martha. So I think the city of Lawrence and the community and the Merrimack Valley would be very proud of all the work and effort of the staff here at City Hall and the staff in the city of Lawrence for what has happened. Although supply of vaccinations is still very limited, through our partnerships with Lawrence General Hospital and other community partners, we've managed to vaccinate over 1,000 people a day at our South Lawrence East location. We've built up that facility to handle probably 200 vaccinations per hour when we need to, when supply is available. And as soon as that supply is available, we're able to increase our capacity. So we're working very aggressively to continue to increase capacity. And I'm proud to say that we jumped on this early, and we're continuing to go full force to make sure that we get everybody vaccinated as soon as we get the supply in our hands.
Wonderful. Martha, you have anything to add there?
I think that Mike put it in very good terminology, and we're all working together. As Mike stated at the beginning, it really is an effort of a lot of partners, and Mike and I make sure that the city of Lawrence is taken care of by having means to get to their vaccination.
Okay. And Yesica, going back to you, what has been your experience, you know, being at the site? You have been administering the vaccines. Can you tell us about your perspective of the roles and how the site is maintaining the COVID safety standards?
Thank you, Mayor. It's actually been great, a great experience up to this moment. I mean, obviously it's gonna be great all this time. However, so everybody's doing an amazing job. I'm very, like, honestly, every day, everybody's happy. Like, honestly, I've never been to a work that everybody's so happy. Everybody has a smile on their face. People are very welcome. They give us so much positive feedback. It makes us do our job better every day. So from the moment patient comes in through the entrance, there's people guiding them, maintaining 6 feet apart. You know, we have the stickers on the floor so everybody knows where to go. They get help with translation. They help with registration. We maintain wiping down the clipboard, the pencils, and in the chair where they sit down. Everybody has a mask before they come into the building, so everybody feel much safe. What else? The moment they come to us as a nurse, we basically make sure the other information are being filled out. correctly. We double check the questions that they already filled out. It actually helped them just to ease their anxiety at that moment too. Like I said, I mentioned before, implementing conversation with the patients, it helped them feel comfortable, right? Excited about getting this vaccine. And actually it just helped us. So we basically have all the hand sanitizers everywhere. We have a way in, a way out. So people who come in through the entrance, people in order to get out, they have to go through another exit. So that's actually avoiding overcrowding and cluster in certain area. So I think so far we've been doing great at this moment. People are giving us patients are giving us so much positive feedback, how happy they are and how good this is. And yeah, I'm very, very happy, and I'm hoping we're getting better and better at this moment. But I'm very, very glad by doing this at the school.
No, this is just fantastic to be able to hear this, especially from a nurse that is working on the site at the South Lawrence East. But as many of you have probably heard, I've been announcing multiple times that with the efforts of Mike Armano, Martha Velez, and a lot of other folks in our city, we are in the process of opening our own Lawrence-specific vaccination site at the Arlington School. So this is a big deal, So seeing someone at the South Lawrence East School, now we're going to transition into the Arlington School. Mike and Martha, can you go into more details about the value of adding this site, and when will we open it?
Okay.
Thanks.
Go ahead, Mike.
Thanks, Martha. So we're very excited. This is really an incredible effort. I think the staff here in the city knew that sites in Lawrence were critical, and they're critical because of many of the health inequities that we face here in the city of Lawrence. We're a dense population. We have a rich culture that does business in Lawrence. We have a strong workforce that has to go to work, that sacrifices for their families as well as for the Merrimack Valley and the Commonwealth that they serve. So with that in mind, from the very beginning, we had so many great people step up. We had public school nurses who came and they decided they were going to vaccinate. Our fire department, our DPW, our staff at Health and Human Services and Inspectional Services all stepped out of their role to make sure that this effort was going to be real and this effort would come true. So starting with that site at the South Lawrence East, we got that strong. And now we always knew that we had to be in the most dense, rich area of our community, and that's in that Arlington district. So we're proud to announce that as early as maybe next Thursday or Friday, we now have the capacity to open up a second site. And that capacity, again, it can serve 200 people per hour. It could serve over 1,000 vaccinations a day. Of course, all of this is contingent on the supply coming, but we didn't want to wait around for the supply. We wanted to be aggressive. We wanted to make sure that our community, who was in desperate need of vaccination and in desperate need to get out of this COVID-19 pandemic, would have what they need as soon as it became available. So that's why we did this, and that's why we're so excited to announce that we're very close to opening this site.
This is great. Martha, how do you feel about this site? This is something that you, Mike, and I, and the fire department, other city employees, nurses have been working tirelessly on. How do you feel about this site?
I can't even express to you the Mike and I sometimes cry, like we actually have tears coming out when we saw the freezers coming in and everything that needed to happen, because anybody that knows me knows that I'm all about community, right? And when we talk about inequities, right, we have to think about what is inequities and how do people feel about inequities. And there's a lot of different ways that people can feel in, that part of not being served. And for me, I'm a grassroots person. I'm all about people. I'm all about my viejitos and my community and making sure. And there's no better place than where we are to make sure that a vaccination site was put up, because this is a dense area where we know that everybody walks to the bodega, goes to the park. There's like 3,000 kids in this school that have family. And we all know I'm Cuban. There's no like 2 people in my family. There's like 10 people in my family. There's 25 people in my family. And I just feel that and I was so happy when you came on and you had that gung-ho, because I feel that if we do this, then we can really start getting back to who we are. The more we vaccinate, the more we help people get healthy and get immune to this, the better we can become as a community, and the more we can start to share our lives with each other back again. So when you said to us, go do it, you don't have to tell me and Mike twice. We're going to go do it. And we're a tag team, and we've done it. And we walk in, as we walked in last week this week on Monday, when we walked in, I was just like taken back. And as Mike said, it's not just a Mike and Martha thing. It's really a team effort. It's the fire and the police department. It's, inspectional services staff. It's senior center staff. It's, recreation staff. It takes a village, and you brought this village together, and we're going to bring it to the city and to the community members so that we can give a little bit of heart and a little bit of health to our community, so we can celebrate again together. Everybody knows I love a party. So, as a community member, I want to be dancing in the streets with you, Mike, and everybody else in this community. So Lawrence, get ready. We're coming.
Mike, I know I'm going to put you on the spot here. There were tears coming out of you. Why?
I don't know. I don't know if they were tears of joy when I first saw that refrigerator, but there's a lot of, it's been a long year. There's been a lot of sleepless nights, just being up at night, thinking about what we have to do to get our community stronger. And in all honesty, I look around at my staff and Martha and her staff and the other departments, and people are tired, but yet they still keep pushing on. And it's so inspirational to me. It's certainly kept me alive during this. And we've gone through a lot. We've seen a lot of sad stories is the real impact, I think, here. You look into the common and we see the chairs of all of our deceased Laurentians, and it's very real to our community. We have almost 18,000 cases of COVID-19 in our community. And we're a population that's so proud and so rich in culture. And we just got hit so hard, probably harder than any other city per capita. And there was so much need here because of the long history of health inequities. So to see everybody come together, to see the departments really just not even stop between the case tracing efforts and the food delivery efforts and the business recovery efforts, and now to maintain that energy to push this through aggressively in a vaccination effort that other communities simply aren't doing. We didn't want to wait around for the Commonwealth. So to have, again, like Martha said, someone like you come in and have the leadership, have trust in the city and the staff, and let the staff move this thing forward. It's been a great inspiration. So we're excited. I'm going to keep pushing forward. Martha's going to keep pushing forward, and I know every member of the city staff will do the same until this is over.
No, and as the mayor of the city, I felt that it was our responsibility to come in and do whatever it takes to ensure that our community can come back to what we used to be, if not better. Lawrence has demonstrated time after time that we are a resilient community. We're stronger than what many people think, and we are always willing to support one another. And I think that that's what we've seen, in terms of our operations to get this vaccination site open at the Arlington School. When I look at the Arlington neighborhood, it's pretty much the heart of the city of Lawrence. Almost all of us has a connection back to the Arlington neighborhood, whether that's a family member, a friend. We've gone to school there. We do our grocery shopping there. It's the heart of Lawrence. All of us have had some type of connection to this neighborhood at one point in our lives. So that's what excites me the most, that we're going to the root of our community. We're going to where it's needed. So I appreciate the support that you are providing within your roles, and to all of the city employees that are behind this, all of the folks that are collaborating. And now that brings me to volunteer opportunities. Are there volunteer opportunities available for anyone in the community who wishes to continue with these efforts?
There definitely is, Mayor. And if I may add one more thing, when you talked about our community, I want to make sure, and I want people to know this, we are a safe community. I want all people, whether you're documented, not documented, have insurance, don't have insurance, You're from all walks of life. The doors are open at the center to get vaccinated. There are no questions asked. We are a safe haven. We really truly believe my house is your house. And I am one person that believes that when we are public servants, we are here to work for community. The door of schools, the doors of city halls, the door of the center, when they open, it is for our public, for the people that we serve. So I just want to make sure that everybody understands that do not be afraid to come to our sites. Do not be afraid to come forward and get a vaccination. It does not matter your legal status. It doesn't matter how long you've been here. It doesn't matter if you have money, if you don't have money. It doesn't matter how tall you are, how skinny you are, how much money you make. It doesn't. It just matters that you're a human being, and we want you to walk in the door, and we want to provide that safe 2-shot vaccination, which will get us to a place where we can start playing baseball. We could start having semanas hispanas. We could light a tree at Christmas. We can have a parade. It just gets us to that point. And if anybody wants to volunteer to help us through these efforts, and trust me, it does take a village, all you have to do is go on the City of Lawrence website, and you could log in there, and there's a volunteer opportunity under the COVID-19.
Thank you, Martha. I think that that's fantastic. Volunteers are always, the city of Lawrence has been proven over and over again that it takes a village, and everyone is willing to, put in their 2 cents to ensure that our city moves forward. But we have discussed, the Lawrence vaccination site at the Arlington School, which I am personally extremely excited about. Logistics for the current vaccination efforts. We've discussed fears the community has and general information. But I also think that it's important that we get some questions from the audience. We have had a very active, audience, whether that's via Zoom or Facebook Live that we're transmitting. So I would like to turn to those questions at this point. And, if you have questions, continue to write those and I'll ask if the time allows. But Dr. Primiterio, I'll come back to you. It basically touches upon one of our questions earlier. Can you talk about what happens after someone contracts COVID, like if they are immune because they went through COVID already? So let's remind folks that, if they should get vaccinated or not, because they had COVID in the past. Does that give you immunity?
We mentioned before, so people, they don't get immunization. They don't get immune to it. You might develop antibody, which on my personal experience, I've been treating over 500 patients at my office with the COVID. And I've been noticing that we have antibodies approximately for 5 to 6 months. The longer one that I saw with antibody was 6 months long after having a COVID. But once again, that goes away. You are still being totally, you are totally unprotected, so you can get it anytime. You can get it from your family, you can get it from relative, and we know normally the closer people that we have, they are the one that we get contaminated from, because with your closer significant others and families, when you take the mask off, you just hug it, you just kiss them, and this is when we make the big mistake, because we live together. No, he's safe, but we don't know where you, my brother, my wife, my significant other has been before you come into the house, and we get it. So let's be clear with the community. If you get COVID, you will get it for the second time. You are not immunized. You should get immunization regardless. And when you have the COVID, you gotta wait 90 days before you can get immunization. That's another very important topic that we have to remind people. That is important. And as well, I remind to all the females, if they're gonna have a mammogram, they should wait at least 6 weeks to get a mammogram study if they get the COVID vaccine, because sometimes they get the lymph node, they get swell as a response of the immunizations, and then they can give you a fourth reading on the mammogram, which is very important for all the women that they get the immunization. To keep in mind, 6 weeks after immunization is when you should have a mammogram done to prevent some headache and develop some fourth reading on your mammogram as well.
Thank you, doctor. Now, Martha, I'll go back to you. This is a question that came via Facebook feed. What should people do if they're asked to show an insurance card at the vaccination site?
So let me explain what the what I, and I've spoken to Lawrence General about this. The reason they ask for a card is because if you have insurance, then they are able to charge the insurance for the administrative fee of the vaccine, not for the vaccine. And the reason that's done is because a lot of this vaccine is coming from the government, right? So if insurance, if we all think about what insurance does, right? Insurances are big companies that are making money. They could help in offsetting the cost to the government. So if someone has insurance and they give their insurance card, the insurance is only processed for the administrative fee of the vaccination, not for the vaccination itself. And that helps with what government has to, it offsets it. You know, insurance companies are a for-profit organizations.
And now, in more details, how are we helping the homeless community get vaccinated in the city of Lawrence? That's a question that also was asked via Facebook.
So the homeless community is being taken care of by Greater Lawrence Family Health Center. They actually have a homeless mobile unit, and they've been going around the city, and they can take care of the people at sites. They've gone to the shelter, they've gone to Mercy House, and they go to shelters where people are that they know that they need the vaccine, and they offer it to them. Now, remember, this is a volunteer thing. So if people choose not to, we try to convince them to do it. But Greater Lawrence Family Health Center has been doing a great job with that.
Okay, so earlier, so the questions that I've asked you came from Facebook. Now, this question is actually from a Zoom participant. Do they have to provide proof of any medical conditions, prior medical conditions?
No, when the governor put this out and he opened the next phase, it's really, it's your word. You say, I mean, there is, when you say you have a medical condition, we ask the questions that are there. And if you say yes, you know, it's yes. And if you say no, it's no. And then we say, okay, we'll put you on the wait list. It's really up to you. It's.
Let's go back to Primiterio.
Honor system. It's the honor system.
And that's exactly how it should be. You know, for anyone who's watching out there, we are doing the best we can to provide this vaccine for you and people that need it. So once again, they will not ask you for proof of your medical condition. I think that it's also important that we are honest with ourselves because there's many folks that have medical conditions that need it. So let's ensure that those individuals have access to the vaccine early on. You know, and we shouldn't be lying. You know, this is an effort that all of us have to play a role in. So I appreciate, Martha, you explaining that there's no need for proof. But I think that at the end of the day, we all have our own, you know, a personal responsibility to the rest of the community not to lie if this ever comes before us.
And it is an honor system, Mayor. And when we do fill out the appointment, we actually have to put who spoke to the person, the resident. That, so if I take the appointment, I have to put my name, Martha Velez, on the appointment saying that I asked the questions and that person. So you're absolutely right. Let's just remember that this is an honor system, and we've been at this for a year, almost a year, and in March 13th, it'll be a year for sure. But we don't want to take it away from someone that needs it. And we've been this patient. So if you're someone that, you know, we got to take care of our elders and we got to take care of our people that are sick so that we can move forward with this.
Definitely. I appreciate you mentioning that. But Primiterio, what are the long-term effects of COVID?
Well, it's been that's a very interesting question because we don't know exactly how many things is gonna come out of this. We are finding as we're going a lot of side effects. How long it's gonna prolong, we don't know, and how many more is gonna come. But I can tell you, it's a lot of people, they side effect, they're having a shortness of breath for a long time. They are still having some cough. They're feeling very fatigued. I've been noticing some males having prostatitis. I have people that they complain of memory impairment. So they are not really retaining and remember things and coming with ideas so quick like they used before. So it's affecting so many things that we will have to take some time down the road and started writing down and some organization on the medical profession, we come out with all those side effects, but it's a lot. It's people coming every day with something that is not common, and you say, "Well, this happened to me after the COVID. I noticed I can walk too fast. I getting shortness of breath. I'm getting, nightmares. Some people getting, post-stress disease after having these, the PSTDs. It's so many other things. So you have to stop and thinking like, this is related with COVID really, or this is something that coincidentally. But yes, I can tell you, most common is people having a hard time breathing, not sleeping well, headache, joint pain, like I say, male with prostatitis and chest pain. So it's so many things that is happening. So, and I'm sure the list is gonna be growing and growing as the time go by.
Okay, thank you. Now let's go back to Mike. Mike, when will the teachers be able and other school staff be able to get vaccinated?
The teachers and school staff are eligible for vaccination on March 11th, which is next Thursday. And they will get vaccinated like any other eligible person. So the most important thing is to try to set up an appointment. If an appointment is unavailable, call the call center, or if they have technology to do so, go to cityoflawrence.com/VacLawrence, get on the list, and allow the city to have the opportunity to call you as soon as those appointments are available. But like any other eligible population, we're starting to see, of course, in group 2, some of our workforce become eligible. And I think this really goes to highlight something special in the city of Lawrence, and that, in fact, is our workforce. And there's so many people that we value, and we're so happy to see that this phase is starting to open up, and we're getting to so many critical people that are necessary to operate our community.
That's great, Mike. And there was a question from a resident, a younger person that says, do you have a sense of when youth will be able to get vaccinated?
I do not. Obviously, we're using the vaccination as an emergency, in emergency operations. That's how it was approved. So I imagine over time, maybe the doctor would have more information on this than I would. But right now, we have a lot of work to do with the eligible groups that are here. So we're excited to move forward with that effort.
Okay. And Mike, can you actually help us clarify the difference in the sites that are in Lawrence, Greater Lawrence Family Health Center is doing vaccines, Lawrence General Hospital, South Lawrence East, in collaboration with us, and the upcoming Arlington site. Can we maybe just explain to residents the difference between each of those efforts?
Sure. So there's different community partners that get together. In fact, Martha and I are on a phone call once a week with all of the clinics that are vaccinating. So essentially, we're pooling our resources to find out where are people vaccinating, what are they doing. We're sharing experiences and best practices, but there are separate entities. For example, our South Lawrence East location, it's a partnership between the Lawrence General Hospital as well as the city of Lawrence. So it's managed by Lawrence General Hospital, and most of the staffing there, the vaccinators, are City of Lawrence employees or temporary employees, public school nurses, that type of thing. The Greater Lawrence Family Health operation, that's done through their clinic, and they have several mobile operations as well as a setup over at the old Payless, I believe it is, off of Essex Street. And of course, the Arlington site that's about to open, that will be a municipal run site, not through a partnership with the Lawrence General Hospital or a Greater Lawrence Family Health or any other hospital or clinic. So we will be operating that site with our staff through activating the fire department as an emergency operation, as well as our nurses and pharmacists and other staff members.
No, thank you for helping clarify the differences and the different efforts that are happening here locally. I think it's important for residents to be able to understand that. But going back to Dr. Primiterio, right now there's 2 vaccines. We have Pfizer and Moderna, which is being administered, to residents locally, because those are the vaccines that are currently available, and it requires 2 shots or 2 doses. What do we expect with the upcoming vaccine that is soon to be available?
Well, you're talking about the next one is coming up. That is going to be only one dosage, like Johnson and Johnson.
Yes.
But this one is, I think it was approved last Saturday, if I'm not mistaken, and that is going to be available pretty soon. And that one have the difference of the Moderna and the Pfizer. We know Moderna is 94% of effectivity versus the Pfizer is 95. This one is 86 effectivity. So it's only going to be one dose. It's easier. It's going to be easier for the people. And Yesica should be know better than me because I don't have the the opportunity to be managing all those immunization. But I know it's a big logistic handling those medication, the temperature, and how you have to mix them and stuff like that. But this one is going to be very, very easy to administrate, and it's going to be only one dosage versus to the other ones, Moderna and Pfizer. But
So yeah, as you
effectivity is
mentioned
a
that.
little lower.
Yeah, no, as you mentioned that, let's ask Yesica. Yesica, what do you think will be the impact in the community? Do you think that will give them more comfort knowing that it's one vaccine versus two? Right now, people, it's important that you remember, it's two vaccines currently. Do you think that it will be better, more appealing to the community in general to have one versus two?
That's a very good question, Mayor. In terms of now getting one into two dose, I like Dr. Vidal's Primiterio mentioned, the efficacy of each one, Moderna being 94 and Pfizer being 95%, it's pretty much a very good efficacy compared to Johnson & Johnson right now with the 84, based on what Primiterio just mentioned. Definitely, people are gonna think it's easier just to get one dose, but honestly, the efficacy was still unknown at this point. So it's something good to look up and ask somebody who might know about the new vaccine. I mean, it's new. We definitely, we're pretty sure about the dose 1 and dose 2 at this point. But Johnson & Johnson at this point, I haven't had that much of research, but we can keep that in mind and inform the community more when we get that information.
Definitely. So, and Martha, let's go back to the immunization card. There was something that was mentioned earlier, and even Yesica talked about immunization card before. If a person loses this card, is there a way to request a new copy of it?
When you go to get your second shot, you should, will give you another one that says that you got it, because we want people to keep it. But remember, this is all put into the database for the Department of Public Health. So everybody has to report to the Department of Public Health that you've been vaccinated. And I'm almost 100% right in this because I've been educated through Mike and everything. And it will be documented in the state that you had your vaccines.
Martha, I want to
Yesica, go ahead. Yes.
Yes. So what we've been seeing a lot at the Lawrence school is that a lot of people they lose their card, and we able to, like I said, that is very important. That is very important. That the questions that you guys previously asked, why it's important to go to the same location, is because of that. Because by having the same system, we able to look it up. And I think it's easier for us and for the patient to get access to what kind of vaccine they got. So we able to get it if they go to the same location. That is a very good question. So yes, we do.
Absolutely right, Jessica. And I think the important part is that it's all documented, Mayor. I just want to make sure that everything has to be documented for the state. So it's not like you can go someplace, right, and not know. When they go back to Lawrence General, they look up their name and it actually says, because it's the vaccination comes in lots, and those lots have to be, logged down. So each person gets what lot you're being given. It's very detailed, as the doctor says. It's not just like fill up a shot and in a vial and then put it in your arm. There's a lot behind the scenes that go on. And to clarify, I would just want to say, Mayor, that I know that you asked me about the different sites, and I have shared with Sabrina that she can post later for people to know if they wanted to book at Lawrence, South Lawrence East, if they want to go to Greater Lawrence Family Health Center. I just felt that it was so much information to give verbally that I passed it on so we could post it later.
Definitely. No, I think that so our intent here is to ensure that we empower our community with information. I strongly and firmly believe that knowledge is power. The more we can provide folks, the better it is. So if you have passed it on to Sabrina to share, that's fantastic. That's our goal here, to get the information out, to get people to be able to call the call center, register for the vaccine at the site that is more convenient to them, and that is why we are opening the Arlington School as a vaccination site. But just to uh, essentially wrap up our discussion here, when we started early on, one of the first questions was in reference to if someone's vaccinated, or they had COVID before, do they need to still wear their mask? And Mr. Primiterio, do they have to wear their mask? Do we still have to social distance? Can I go visit my grandmother, my grandparents, and can I have a party at home with 20, 30, 40 people, to celebrate a birthday? Can we do that now? Should we be doing that today?
I like that, Marta. That looks really good. So, like we were
Yes.
mentioning before, you can still be a carrier. It's a lot of people when you're like, let me do this very in a simple word. It's like you can have the virus on you even though you are not sick. You can be passing it on to other people. That's why we need to wear a mask. That's why we need to keep our social distance, because even though I look and I am healthy, but I might have the virus on me and I can pass it on to my relatives, to my friends, to my elderly people around me. So definitely we need to wear our mask. We need to keep social distance, regardless that you have the COVID, regardless you already have your two shots. We have to keep this until everybody is safe, everybody's immunized, and we know that we can return, like Martha was saying before, to have our life back and be able to hug each other, to be able to go to Semana Hispana, to dancing together and be like a big family like we used to and we are missing for almost a year now.
And that's exactly what we need to get across to all the people. It is important that we all do this, collectively. One person won't be able to make the big difference here, but if we all come together, understand that this is a collective effort, it will be better. The sooner we do this, and the sooner we understand this, the sooner we'll be able to resume our lives and come back to what we know as normal, and if not better, because I'm a hugger. I'm a person that I just love to hug people all the time, and it feels very uncomfortable not being able to do that. I really wish to be able to come and hug and kiss individuals. I love it. That's who I am as a person. So I ask all of us to, we've been providing this information simply because we want you to have factual information with you, and not just rely on what's been posted in social media. As you know, there's a lot of folks that don't simply understand what's happening, and they will start sharing information that is not truthful. Always rely on factual information when it comes to making a decision. We are doing the best we can to provide that for you. We have asked this wonderful group of panelists to join us. And with all honesty, look, I am grateful that you have taken time out of your busy schedules to join us tonight. I'm very proud of everything each of you is doing individually and for on behalf of our city. As I mentioned earlier, knowledge is power. So thank you once again. And I'm just going to open the floor to each of our panelists just to say, a final comment before we end this dialogue. So, Mr. Primiterio.
Thank you very much. I have to say thank you, Mayor, for giving me the opportunity. Thank you for the great job that you and your staff is doing at the City Hall. It's been amazing so far. You're doing what is supposed to be done in the city, and you earning the trust of the community. We need people like you, and I want to do that in public. Even though I'm not a political person, that I'm out there. I hate politics, but I know you as a human being. I know you as a friend, and I know you as what you're doing there. And I'm really proud of you. And on behalf of my community, Lauren, which is my first home now. I'm not gonna even say my second house. This is my first home now after being here for 30 years. I haven't seen something getting done like you're doing. You're working hard for your community. We need that. We need to work together, and we need to prove to those people we can make the difference. We can make it, and we are working hard to change the city and working for all those people out there that are depending on every single one of us to make difference and go back to be the city of Loring. Happy, friendly, family hugger. Like you say, we are huggers, so we love to hug people. We are Hispanic people, which we like to be hugging everybody and kissing everybody. And this community have a lot of Hispanic people that I love to do that. So thank you very much for all the effort that you guys at the City Hall are doing. The same thing for Mike, Martha, Jessica, everybody there that has been working hard. Let's keep doing this. We can get better, and I'm sure we will. And once again, Mayor, you're doing an excellent job. Keep it up. It's gonna be worth it at the end. Trust me.
Thank you. This is all for our people. I think that it's important that we do the best we can collectively to support our community. And this is an effort that even though a lot of folks are seeing me possibly in the news and the paper, my face is present. I don't do it by myself. This is a collective effort. It's an effort by all of the staff here in City Hall, with different institutions that are doing the best they can. So I appreciate your comments. But at the end of the day, this is something that we're doing all together as one unit. So I appreciate that. And, I am proud of the team that is working with me in this effort to do, the best we can to ensure that we move the city forward. Jessica.
It's been an honor to be sitting down with you guys. It's an honor to be with you, Mayor Kendrys. I mean, to get to know Mike Hermano, Martha Velez, Vidal Primiterio. It's so exciting because knowledge is power, and we need it in this community. I'm 100% down with you guys. It's a collective. It's a force, man. Like it's collective. We can do it. It takes a village, but we can do it. This city has to get better. We all can do it, and I'm very glad to be invited for this panel. Thank you so much.
Oh, thank you for joining us, Jessica. Truly, thank you. I appreciate it. Martha.
I'm gonna cry, okay, because I love my city, but I love my elders more than anything, and I miss them so much, and I've had so many losses because of that. A lot of my elders that I know have passed away, and we haven't been able to go to a wake. We haven't been able to go to a funeral. And it's just something that really, it hurts deep inside. And every day I get up, I want to work with Mike because I want to make sure that my city is healthier. I don't want to see another person pass away. I don't want to see another person get sick. I don't want to see people going. I lost my father a year and a half ago, and I couldn't imagine me not having to be by his side when he was passing. So like what these families are going through, the empathy that I feel for everybody that has to go through this is what gets me up every morning to fight. And the only way we can do this is together. A beach is built by many sands, particles of sands. So we need every single one of those things to come together to build a beach. We need everybody in this city to come together to make us healthy, to make us whole, and to make us who we are. We are a community of melting pot. We are a community of love, and we are a community of many different cultures. I want us all to love each other and to do what's right for one another. Take care of ourselves and get vaccinated. Vaccination saves lives, people.
Thank you, Martha. Thank you. Mike?
Thanks, Mayor. Earlier you had mentioned volunteers and people willing to volunteer. And I remember when we first mentioned opening up the Arlington site, we had a research professor from Boston University approach us, Kim Sullivan, actually a Lawrence resident, and she had worked with many people from the community to come up with a list of over 400 volunteers instantly. And then we had partnerships, Northern Essex Community College, Riviera, and so many others come to us wanting to help out. And we had the Lawrence partnership and the business community wanting to help out. It was just a true effort of community and knowing that we needed to do something big. So I guess between that and between the realization that our workforce although all this has been going on, they continue to go to work. They continue to serve the Merrimack Valley. They continue to serve Massachusetts. This is the stuff that inspires me, seeing all these people wanting to work and continue to work. And there's so many true heroes that have stepped up during this pandemic. So I just want to say I'm grateful to all the workers who have to go to work and risk their health in doing so, to all the volunteers who have stepped up. And lastly, of course, I guess I don't get to do it too often, and Martha and I often thank each other, but I'm grateful for my colleague, Martha Velez, and everything she's been doing. Thank you, Martha. We've been in this together, and I'm grateful for all my other colleagues, department heads. A lot of people don't realize that when we have operations like this, it's all of the city departments that come together, and they're so critical, and they don't realize how closely we work together. We're on a meeting on a weekly basis with you, Mayor. You bring the department heads together. Everybody has efforts. Everybody has things that they contribute, and they continue to do so. It's such an important thing for the community to know. And again, like I always say, you would be so proud if you saw the workforce that's coming together to fight for your community.
Definitely. No, I appreciate that, Mike. And once again, I am grateful to have both of you in my team here. We're doing this as one versus, individuals. And I'm just at a loss of words. I've seen what we've accomplished together since I joined as mayor. And I think that, this is the right thing to do. And I appreciate the sacrifices each of you are doing. I call you very late at night, very early in the morning. I don't really know when you guys sleep, actually, as a matter of fact. There are times in which I've been at City Hall working, at 9:30, and as I'm walking out, Mike is walking out. But then in the morning, I'm like, hey, Mike, it's 7:30 in the morning, 7 in the morning. I'm calling, and he's answering the call. And the same goes to Martha. So I don't know when you guys get to sleep, and I need you guys to also rest a little bit, because we have a lot more to do for our community. But I know that this is something that you both are committed to, and I appreciate it. And, I'm speaking to you guys because you're in the call today, but I feel the same for a lot of the other department heads. They are working nonstop, tirelessly, to all of our volunteers, to Dr. Primiterio, to our nurse, Yesica Santana. We brought in, between nurses and pharmacists, I believe it was close to 40 individuals over the last couple of weeks. So I am very grateful to them that they're also sacrificing their family to support our community. This is a big thing. This is amazing, guys. I just want to say thank you again for providing information and helping all of our residents feel more comfortable and confident that, we're definitely moving forward in the right direction and trying to get people vaccinated. For the folks that are still watching, whether it be at Zoom or Facebook, thank you for joining us. Thank you. Simply thank you. Once again, we want to remind you also that the vaccination call center is available, and you can set up your appointment. The phone number is 978-620-3330. I'll repeat myself, 978-620-3330. And if you have any more information or you would like to pre-register, please remember that you could do so by visiting cityoflawrence.com, VAC Lawrence. cityoflawrence.com/VAC Lawrence. So I know that I've spoken about the panelists at this point, but I think it's also important to say thank you to our wonderful interpreters. They did a fantastic job. We had Tasha Spendes, who was doing Spanish interpretation, and we also had Trudy and Simon, who were doing ASL. So thank you, guys. I appreciate it. Thank you. Hats off to you. I know you've been doing this nonstop. And also our fantastic IT director who helped us put this together. We're live and all of it. My office staff, Sabrina Boyo, my chief of staff, Adeli Gonzalez, Sheila Ramirez, and Diana, that many of you met earlier as we started the meeting. So thank you for all of the work. Diana, thank you for ensuring people were able to get the necessary interpretation as you you presented it earlier. You know, a lot of interns who have supported this effort as well. So a big thank you to all of our interns who have helped. Jennifer Lopez, yes, we have a Jennifer Lopez intern in the office of the mayor. So JLo works for us. I'm very proud to have JLo here. Uh, so this is fantastic. Anyways, I know that I don't want to keep you guys any longer. I could stay on for the whole night if you allow me. So I just want to say thank you guys.
You're welcome. Our pleasure. My pleasure. Thank you.
And I look forward to seeing many of you at the vaccination site at the Arlington School. Please make sure you pre-register. Okay, thank you.
Thank you.
Bye-bye.